Thanks so much for listening to this presentation on jugular venous pressure point-of-care ultrasonography. My name is Janine Desi, and I'm a general internist at the University of Calgary. The use of JVP to estimate central venous pressure was first described by Sir Thomas Lewis in 1930. Since this time, the JVP has been considered to be the manometer to the right atrium. When measured above the angle of the manubrium, 5 centimeters should be added to the JVP measurement to estimate CVP, right atrial pressure, and in the absence of tricuspid regurgitation, to also predict right ventricular end diastolic pressure. The JVP can be elevated in many pathological states arising from a high right ventricular end diastolic pressure, obstructed inflow to the right heart, or hypervolemia. The JVP can be low on the other hand due to hypovolemia from any cause. The JAMA Rational Clinical Examination Series recommends to use an upper limit of normal of 3 centimeters above the sternal angle for the JVP measurement. A JVP that is higher than this cutoff has a positive likelihood ratio of 3.4 for elevated CVP. If the meniscus is not seen at all, this has a positive likelihood ratio of 3.4 for low CVP. Unfortunately, although the JVP can be helpful in predicting the CVP, it can be difficult to visualize the column in obese patients, those with a short neck, and those who have very high central venous pressure and for whom it's impossible to see the top of the column. Overall, the JVP can be seen in approximately 20 to 84% of all patients, and when it is seen, it is within 2 centimeters of the true CVP only 47% of the time. So is ultrasound any better at predicting the JVP height? During this short presentation, I will go through the anatomy of the jugular vein, the technique used to visualize the top of the JVP using bedside ultrasound, and will mention some of the limitations of this technique. This video shows the location of the internal jugular vein, which runs behind and between the 2 heads of the sternocleidomastoid muscle up towards the angle of the jaw. Now let's talk about how to visualize the column using bedside ultrasound. To image the internal jugular vein, you should choose the linear transducer, which is a high-frequency probe that has good resolution for superficial structures like this. When imaging the JVP, be very careful not to press too hard on the patient's skin so that you don't compress the vein. Once you find the point of collapse, try to position the patient so that the point of collapse is at their mid-neck, just as you would with regular physical exam. Again, like the regular physical exam, also measure the height of the column at its highest point, which is normally at the end of expiration. To determine the height of the column, you'll image the internal jugular vein in 2 planes, transverse and longitudinal. Most people start by performing a transverse view of the vessel. Position your patient just as you would for a physical examination of the JVP, and then place your transducer in a transverse fashion on the right proximal neck just above the clavicle, with the probe marker facing to the patient's right. On this view, you should be able to see the internal jugular vein, which is usually located anterior and lateral to the common carotid artery, although variations of this orientation can also be seen. Gently compressing the tissue with the probe should help you differentiate the vein from the artery, as the vein should be fully compressible, whereas the artery should not be. In addition, the artery should be thicker walled and pulsatile. If you are unable to differentiate between the two using these techniques, you can go on to perform Doppler imaging of the direction of flow in each vessel, but this is beyond the scope of this presentation. Once you have identified the vein, adjust your depth so that the vein is approximately midway down your screen. Slowly slide the probe cranially until you find the point of collapse, which is the location at which the vessel collapses, as you can see in this video. The point of collapse, seen at end expiration, should correlate with the top of your column. Now that you think you have found the height of the JVP, Turn your probe longitudinally so that the probe marker is facing cranially. Again, slide the probe towards the clavicle and try to locate the internal jugular vein in a longitudinal axis. As you see here on this view, the jugular vein will usually be lateral and more superficial to the carotid artery, which means that on your screen it will be closer to the top. Once you think you have identified it, again try to compress the artery and the vein to ensure that you're looking at the right column. If you have found the vein, adjust your probe orientation until you can see the vessel in its largest plane. At this point, slowly slide your probe cranially until you again find the top of the column as seen in this video. In the longitudinal axis, the top of the column is sometimes referred to as a bottleneck. To measure the top of the column, center the bottleneck in the middle of your screen. Once you have achieved this, the top of the JVP column will be located at the location corresponding to the middle of your ultrasound probe. Just as usual, measure from here to the angle of Louis and add 5 centimeters to estimate the true CVP. Just like on physical examination, the internal jugular vein will have a biphasic waveform when visualized on ultrasound. As already demonstrated, it will also be compressible. It will also change with respiration. In this video, the vessel can be seen to collapse completely at this location when the patient takes a breath in. The hepatojugular reflex can be easily demonstrated using the ultrasound machine as seen in this video. So let's look at a few findings. This video was taken just above the clavicle in a patient that was lying supine. The fact that the top of the column can be seen at this location suggests that this patient's JVP is low. Here's a longitudinal view of the same patient's internal jugular vein. Here's an example of an elevated JVP. This transverse image was taken at the angle of the jaw in a patient sitting completely upright. As you can see in this video, the vein is just starting to collapse at this level, suggesting that the JVP is high. This is a longitudinal view from the same patient. Thank you very much for listening to this presentation. If you have any questions or comments, please feel free to contact me.